Joining us now, director of the Vaccine Education Center and an attending physician in the Division of Infectious Diseases at Children's Hospital of Philadelphia, Dr. Paul Offit. He's also a member of the FDA's Vaccine Advisory Panel. Let's start with that wild card, the variants. What are the concern levels in terms of the variant obviously spreading very quickly and the vaccine applying to the variants?
That's the critical question. I mean, you have this so-called UK variant, the B.1.1.7 variant, that's now more contagious and is spreading across the country. So the critical question is the immunity that's been induced by natural infection with the other strain, or the immunity that's being induced by the Pfizer and Moderna vaccines, if you've been naturally infected or vaccinated, is that going to protect you against this variant? And by that, I mean protect you against hospitalization, ICU admission, death. So far, all the evidence is yes, it does. And that also appears to be true for the other variant, the South African variant, which is the so-called B.351 variant. And that's the critical question. I think a line gets crossed if you see people who are, for example, fully immune that nonetheless, when exposed to these, either any of these variants or then hospitalized, that's when we have to think about a different strategy then for at least or at augmenting our current vaccine strategy. That hasn't happened. That hasn't happened in the world yet. So a line hasn't been crossed yet.
And how is the country faring in terms of getting the vaccine to the people? It feels like the president has moved the bar up a little bit, and I'm hearing April, I'm hearing this summer. What's your best estimate from the data that you have?
Right. It's we're trying to do something for which we don't really have a public health system that's in place for that. I mean, which is to say a public health system geared toward mass administration of vaccines to adults. We're learning to do that. And we're learning to mass produce this vaccine and mass distribute it and mass administer it. I think we're getting there. I mean, we're a little over 1.5 million doses per day. We need to get to, I think, about 3 million doses per day to reach our goal of trying to really get this pandemic in hand by the summer. I'm optimistic that that can happen. Also, you have to be really impressed by the fact that here it's mid-February and this winter respiratory virus, which should be raging now, isn't. I mean, we have a decrease in cases, decrease in hospitalizations, decrease in deaths. Why is that? And I think understanding why that is going to make a big difference as to what we're going to see over the next few months. One possibility is that we're having some evidence of herd immunity. We list on that roughly 28 million people in this country have been infected, but that's just the number of people who've been tested and found to be infected. Many people who are either asymptomatically infected or have mild disease never get tested. So the only way to really know how many people in this country have really been infected is to do antibody surveillance studies. When those studies were done in November, this number that we give is 28 million was found to be off by a factor of 4. It could be as many as 80 million people who've already been exposed to this virus and are likely immune. That's 25% of the population. Plus, as you just said, more than 50 million doses have been administered. It's another 10%. You're at 35% of the population. That's good. And if that's the reason why, then it's just going to get better because we're going to keep vaccinating. The weather's going to get warmer. And I'm choosing to be optimistic here that we're starting to see a light at the end of the tunnel.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.